My name is Mark. I'm a husband, a father, a grandfather, and a heart patient. I have ventricular tachycardia, or VTach. Behind every heartbeat is electricity. My heart was sparking in several places and caused my heart to race, and then stop. The defibrillator I have was not able to regulate the rhythm. I needed answers, and I was referred to Dr. Roderick Tung at Banner. I have had a lot of tests, EKGs, MRIs, ECGs, stress tests, and even genetic tests. My condition turned out to be more complex. I had an ablation procedure, and I feel great. I trust the care of my heart to Dr. Tung and his team. I live in Prescott, and traveling to Phoenix is worth it. I hope my experience will help others get the best care for their hearts.
My name is Roderick Tung, and I'm a professor of medicine at the University of Arizona College of Medicine in Phoenix, and I'm also the chief of cardiology at Banner University Medical Center and the director of our Cardiovascular Institute. It is so wonderful to see how well Mark is doing, and the relief that you see in a clinic visit after we've been through a lot of investigation and a medical procedure is really what makes us feel so fulfilled. This is exactly why we do what we do. The patients that struggle from his condition, which is called ventricular tachycardia, this is an abnormal, rapid, and often life-threatening condition from the lower chambers of the heart called the ventricle. This is one that patients typically need a defibrillator to get rescued from, and they often get shocks from the defibrillator, which is what he came to us with in therapies. So we try to put out that fire with something called catheter ablation, which we go in and we cauterize and burn some of the areas that are particularly flammable and create these arrhythmias. And his outcome has been fantastic. So his case is extremely interesting, but you never want to be an interesting patient, but he's just been so wonderful in the sense that he's felt the confidence that coming from Prescott down has been worth the trip. Because only here do we really try to dive into some of the things that go beyond the community practice of medicine, which is asking the why, and how did this happen, and get into the genetic causes, the underlying etiologies of whether this is something called sarcoidosis. So this is still a story that is unraveling, but what's most important right now after his ablation is that he's not suffering from recurrence of these arrhythmias.
Every heartbeat counts in a life well lived.